Okay, let's see.
This meeting is being recorded.
No, we have Medicaid and Medicare here and Medicaid Direct. If the person has innovations or the TBI waiver, they're still in the tailored plan. We have people who are medically needy in this category, people on the health insurance payment program, which is NC-HIP, are in the North Carolina Medicaid Direct, LME, MCO, and CCNC program, unless they have innovations or the TBI waiver, and then they're in the tailored plan. Children who receive Cap C services are in the LME, MCO, NC Medicaid Direct system. People who receive Cap DA are in the same system, and then children and youth in foster care. With all of that said, just to give a little bit of a caveat, children who receive Cap C services, they don't typically interact with the LME MCO unless they have an IDD, intellectual developmental disability, mental health, substance use kind of need. Same with Cap DA. So the Cap DA and Cap C are maintaining themselves in a very similar manner. The next population is the Eastern Band of Cherokee Indians tribal option with the LME MCO. And that's for the population that's enrolled in the Eastern Band of Cherokee Indians. It's for federally recognized tribal members. And they are able to provide services through the Indian Health Services, and it's available in the counties below. And then if they have those behavioral health IDD support needs, they're going to get them through the LME MCO, which is functioning through the tailored plan. So the tailored plan is going to have an LME MCO contract to provide those behavioral health services to both of those populations. Sanja, is there anything you want to add to that?
I do. I want to make sure that everyone is clear that the North Carolina HIP program is not going away. And if you are innovations or TBI waiver participants and you're also involved in NC HIP, you will be able to keep your NC HIP. Then another point I want to make is with the EBCI tribal option plan, it is available in the counties listed, but the person does not have to be a member of the Eastern Band of Cherokee Indians. They can be a member of any federally recognized tribe or be an IHS eligible to participate in that plan.
Great, thank you so much, Sanja. And then again, just to go back to that NC Medicaid Direct kind of box. So that's how people who are currently receiving services through the LME MCO now are really receiving their services. So they're getting their behavioral health, their intellectual developmental disabilities, their substance use services through the LME MCO, and then their physical health services are coming through Medicaid Direct or fee for service. So for that population who's in that gray square, it's going to be very similar to how things are now. So just to let you all know that. One kind of caveat is that people who are in NC Medicaid Direct with the LME MCO, they still would, if they have Medicaid, tailored plan care management would be available, so that's a benefit. And they can also take part in the 1959 services. But they're not going to be fully enrolled in the tailored plan. So here's another kind of slide about NC Medicaid Direct. So it's North Carolina's healthcare program for Medicaid beneficiaries who are not enrolled in the standard plans, the Eastern Band of Cherokee Indians tribal option, or the tailored plans. So just the slide that we saw before. Then on December 1st, 2022, NC Medicaid will transition beneficiaries who need certain services for mental health disorders, substance use, support needs, intellectual developmental disability, or traumatic brain injury to the tailored plan. So again, if they're not carved out and remaining into Medicaid Direct, that's who's kind of going to the tailored plans when they go live. Some beneficiaries will remain in North Carolina Medicaid Direct or choose to stay in NC Medicaid Direct. So again, going back to that slide, that's what this is, just kind of breaking it out a little bit more. Then we have a little call out box at the bottom to explain what NC Medicaid Direct is with the LME MCO. So beneficiaries who are not enrolled in the tailored plan will receive services for a mental health support need, substance use support need, intellectual developmental disability, or traumatic brain injury from the LME MCO. And the tailored plan will serve as the LME MCO for those beneficiaries enrolled in NC Medicaid Direct. So we know right now we have 6 LME MCOs who are going to become tailored plans. When those tailored plans become tailored plans, they're still going to have a mechanism to do that LME MCO work. Okay. Sanja, anything you want to add to that one?
Yeah, I think you're pretty clear on that one. I think Lisa might have had a a question. I saw her raise her hand.
Yeah, let me attempt here, Kenneth, to apply this. Let me translate a little bit and you tell me if I get it right. Because
Sure.
I'm trying to imagine what people are thinking. Oh my goodness, let's take Alliance, for instance, because they're going to be responsible for about half the Medicaid members in the state in this category. So let's say Alliance is becoming a tailored plan on December 1st. That doesn't mean they're giving up their LME MCO status.
Correct.
The tailored plan is like layering an insurance plan with tailored services on top of the LME MCO's responsibilities, right? So for one group of people in that insurance plan called the tailored plan, they'll receive one set of services. For everyone else who remains in Medicaid Direct, instead of moving into that insurance plan called the tailored plan, they will continue to get their services in the same way through Alliance. This could be via Trillium, East Point Partners, Sandhills, fill in the blank.
Exactly.
Continue to receive the same sorts of things from their LME MCO. So the LME MCO is not completely going away. They're just adding a layer, another function.
Correct.
And that's
Right.
where the managed care for Medicaid members comes in.
Right. Exactly. Yeah.
They'll be providing physical help as well as the mental health,
In the
behavioral health.
tailored plan portion.
Correct. Yeah.
Yep.
Right.
Okay, I think that's a very helpful distinction.
Right.
I'm
And we
not
can
sure my
think-
example is clear enough for everybody, but I'm going to try to give examples like that as we move through it.
Right. That's very helpful. Thank you. Okay. So again,
Guys, I got a request if you could put that in presenter mode. Is that a possibility? To put your slides in presenter mode?
Let's see where
Okay.
it goes.
Or from, there you go.
Can you all still see it now?
We can see that in the next slide, which is, it's fine. I've just had some requests for presenter mode, but I would just
Yeah,
keep on going.
let me see if I can flip it real quick. I'm going to stop sharing for a moment.
And you guys have great questions in the Q&A. I'm seeing them all and we will get to them, I promise.
Okay. Can you all see it now?
Nope, we can see you though. It's a lovely forest behind you.
You still can't see it though?
Yeah.
Not
Huh.
yet.
We'll working through that just so everyone knows. If we don't get to everyone's questions, we've got a copy of everything. We've been putting together a comprehensive FAQ. And so if we've got your contact information, which we should have because you registered for this, this is not the only time we're going to be talking about all the issues around care management. We're going to be back on the 9th, the September or October 9th. Is that right?
Yes, I got ahead of myself. We actually have one on September 19th before we get to our October ones. So we have
Gotcha.
two coming
Okay.
up. Yep.
So we'll be doing some introductory basic 101 care management that we've done before. We're going to do that again. And we're going to do some deeper dives into things like the I waiver and 1959 waiver. And I'm throwing stuff out there that you may not be ready to even think about. That's why we're doing that on a different afternoon. So we can kind of keep subject matter direct and keep on target with what we're talking about tonight. But every question we get, we are keeping track of, and we will be putting together and have a comprehensive FAQ that is growing as we go every single day. So don't despair if we didn't get to your answer tonight. I guarantee we're going to be coming back to it at some point in the next week or two, and hopefully before people get too stressed over circumstances and the changes.
We
Great,
see it,
thanks.
Kenneth. You can
It
keep
looks
going.
right
Yeah.
now.
Sure.
Okay, great. Okay, so standard plans, just going over the same information we went over that second kind of slide. It's going to be approximately 1.7, or it is approximately 1.7 million Medicaid beneficiaries. So again, that's the majority of the populations. And the following standard plans are available statewide. So these are the names that you're hearing with standard plans. So AmeriHealth, Caritas, Healthy Blue, United Healthcare, and WellCare. Carolina Complete Health is more of a regional standard plan, and it's in regions 3, 4, and 5. So you can see on the screen here where it kind of falls. So we just wanted to let you all know what the standard plans are, just to ground us again with that. Okay. Standard plan versus tailored plan overview. They're both healthcare options, and they're based on the Medicaid statuses. So again, if you look at that first part, it really talks to what Lisa and Sandra were talking about in terms of them being health insurance programs. So the standard plans provide integrated physical health, behavioral, pharmacy, long-term services and support to most Medicaid beneficiaries, as well as programs and services that address other unmet health-related resource needs. So that's what we typically think of, things that are outside of what your health insurance would typically pay for. So that's those healthy opportunities, those value-added services. So you could potentially, some of them are offering things like phones, air conditioners, if someone has problems with asthma, that kind of thing. For standard plan, enrollment is based on the beneficiary's residential county. That's where the person lives. And then they have the ability to choose the standard plans based in that area. So now if we go over to the tailored plan, this kind of, again, gives more context. The tailored plans will provide the same services as the standard plan. So again, it's that integrated physical, behavioral, pharmacy, and long-term services and supports, plus additional services for people who have more significant needs that are mental health related, substance use related, intellectual and developmental disability related, or traumatic brain injury related, and or if they have a need that's only paid for with state funded services. So when we think about those services that the LME-MCO currently provides that aren't Medicaid services. So that's one of those caveats as well. Enrollment for this population is based on the beneficiary's administrative county. So the county that manages the beneficiary's Medicaid case, and that's currently how the LME-MCOs work now. And there's only one tailored plan per county. And if the beneficiary's administrative county changes to a different service area, they will move to the tailored plan that offers services in that county. So very similar to how things work now with the LME-MCOs. If someone's administrative county changes and they're outside of the LME-MCO's catchment area, then they transition to the new LME-MCO where that catchment area is. And Sandra, anything to add to this one?
No, I don't think so. Not unless someone has questions around it later.
Okay.
Let me just add a reminder here for most folks who are probably listening today. You might remember the standard plan launched about 1.5 years ago. It's been running now for the majority of Medicaid members in the state. Remember, the tailored plan has more tailored services for folks with IDD and the other disability categories that fit in the tailored plan. So most folks with IDD we expect will be in the tailored plan. You got to remember the standard plan, they have some cool services, but not the kind you need for the most part. So we often get the question, should I go in the standard plan or the tailored plan? You're going to get more customized IDD services in the tailored plan. That stuff is not in the standard plan.
Thanks, Lisa. So that kind of leads in well to this next slide. So again, the tailored plan is going to provide that integrated physical health pharmacy, those higher levels of behavioral health services, and then those more long-term support services related to intellectual and developmental disabilities or traumatic brain injury. So services for the innovations waiver and the TBI waiver beneficiaries and waiver waitlist beneficiaries are in the tailored plan. They have added services such as wellness programs. So similarly to some of those value-added services that the standard plans have now, as the LME-MCOs transition to tailored plans, they'll be able to offer those value-added services. Currently as LME-MCOs, they cannot. It will include non-emergency medical transportation for Medicaid covered services. And also it will include tailored care management. And that tailored care management will focus on the whole person to help address physical pharmacy, so everything that we talked about before, and will also address those unmet health-related resource needs or those non-Medicaid resource needs. And that tailored plan care management has a glide path to be 80% within the community within 5 years. So it's building up to be more of a community-based care management closer to where the person lives and works. And then the tailored plan is also going to provide those state-funded services. So again, those services that the LME MCO provides that are non-Medicaid. So sometimes that's like group home assistance, sometimes that's personal assistance, sometimes that's supports related to the TCL population, those kind of things. Meaningful day for the IDD population. Then this is just a TBI waiver slide, but we're gonna keep going because we're running out of time.
So real quick, I need to jump in. There's a couple questions that have come up about acronyms. TCL is transition to community living. TBI is traumatic brain injury. Those are terminology we hear. LME MCO or LME MCO, if you hear it quickly, stands for local managing entity managed care organization. Those are the agencies that the funds funnel through. So Alliance, Partners, Via, Trillium, those are the LME MCOs. They will become tailored plans on December 1st. So when we say tailored plan or LME MCO, for the most part, for simple purposes, those are interchangeable terms.
Right. And then again, kind of dovetailing in here, the LME MCOs or local management entities, managed care organizations, are going to transition to tailored plans, but still maintain some of those functions related to the LME MCO. And you'll see there Alliance Health, East Point, Partners, Sandhills, Trillium Health Resources, Via Health. So again, this kind of talks about the 6, and it's also going back to the fact that it's based on your administrative county or where your Medicaid originates from. Okay. So now we're going to get into some of the questions that we've received. They're not all of the questions. We'll be able to walk through some of those outside of the presentation, but we got a whole lot about Medicaid and Medicare duals for people who are on the NC Innovations and NC TBI waiver. So beneficiaries on the NC Innovations waiver are TBI waiver, traumatic brain injury waiver, including dual eligibles or enrolled in tailored plans. Exception is the tribal population beneficiaries who are on the Innovations waiver, the TBI waiver, who are not required to enroll in the tailored plan to receive those services. And that goes back to that Eastern Band of Cherokee Indians plan. Okay, so for the vast majority of people, almost exclusively, individuals who are on the Innovations waiver or the TBI waiver and have both Medicare and Medicaid will be in the tailored plan. Okay. And Sonja, jump in whenever, if I'm getting off track.
No, you're doing great.
Okay. So the next one is Medicaid and Medicare duals, non-innovations and non-NCTBI waiver. So beneficiaries on the Innovations or traumatic brain injury waiver wait list were enrolled in the tailored plan unless they were otherwise in an excluded category. So that goes back to that third slide with that gray box for Medicaid Direct. So if you're on the Innovations or TBI waiver wait list and you don't have Medicare and Medicaid and Medicare duals, you will be in the tailored plan. If you do have Medicaid and Medicare, then you will be in the Medicaid Direct portion with the LME MCO for those behavioral health, intellectual developmental disability services. So again, if people don't have Medicaid and Medicare and they're on the Innovations wait list, they're in the tailored plan. If they're on the CAP-C waiver, they'll be in Medicaid Direct because CAP-C is not going into managed care yet. If they're dual eligible beneficiaries, Medicaid and Medicare, they're not going to be in the tailored plan. They're going to be in that Medicaid Direct LME MCO partnership. And then if the person is in the foster care, adoption, or former foster youth population. So again, what we said on that other slide that was carved out, individuals who are not on the Innovations waiver or TBI waiver and have both Medicare and Medicaid will remain in Medicaid Direct. They will receive services for their mental health support needs, substance use support need, intellectual developmental disability, or traumatic brain injury from the LME MCO. And again, that LME MCO will be the tailored plan for that region. Okay.
A lot of questions about folks who've received B3 services from the LME MCO and are dually eligible. Will they stay in the tailored plan?
So if they're Medicaid, Medicare, and they're non-innovations, so if you're on the B3, if you're using B3 services, you're non-innovations, you're non-TBI, you'll be in Medicaid Direct and continue to receive those similar services from the LME-MCO. And that's when John was talking about that transition to the 1959 services. That will be in both the LME-MCO side as well as the full tailored plan. Does that help?
And those folks will also be eligible for care management, correct?
Correct, as long as you have Medicaid. Yep.
Mhm.
Yep. Okay. The next one is NC HIP. So that's that health insurance premium program and the NC Innovations and NC TBI waiver. So individuals who are on the NC Innovations waiver or the NC TBI waiver and have NC HIP are in the tailored plan. Okay. Again, if someone's not on the Innovations waiver or the NC TBI waiver and they have NC HIP, they'll be in that partnership between Medicaid Direct and the LME-MCO, similar to how things are now. And as Sancha was saying before, NC HIP is not going away. So that was something that we were hearing, but we wanted to just make sure everybody knows that NC HIP is definitely staying.
And they can keep their NC HIP if they're on the tailored plan in Innovations waiver or TBI waiver. So they can maintain their NC HIP.
Okay. So auto enrollment began August 15th. And that's when people who were qualified for the tailored plan got auto enrolled into tailored plan based on their county, where their county originates from. So what we were talking about before, and then their managed care status, which basically means that they had a diagnosis and a use of a service that's only available in the tailored plan. The choice period is through October 14th. So during this time, everybody can start choosing their primary care provider or their tailored care plan, tailored care management provider, or a different health plan if that's the choice. And then to choose the PCP or the primary care physician provider or the tailored care management provider, they will do that with the tailored plans, and the beneficiary or their families should contact the tailored plan to do that. You can also contact the enrollment broker for choice counseling. And then if you want to choose a different health plan, beneficiaries should always contact the enrollment broker. The beneficiaries may contact the enrollment broker again. They offer that choice counseling enrollment assistance. And then again, to choose the actual primary care provider and the tailored care management provider, you would contact the tailored plan who's on your Medicaid card, as well as in the letters that you all have been receiving. So I think that's an important distinction of how to move forward with that. I know that we've heard from a variety of people that their physicians or their primary care practice may not be there. The tailored plans as well as the state are working hard to get those networks up, as well as there's more and more tailored plan care management agencies coming on board. I think when the letters went out, there weren't too many who were uploaded in the system, but there's more information coming out about that in an FAQ that the state, our agency, is working on. And Sanjay, anything else you want to kind of add to this?
No, I don't think so. Sorry, y'all, my dog is being loud.
Kenneth and Sandra, I'll say that we do have a lot of families who are going to ncmedicaidplans.gov or the state website to find a provider, and they're of course not seeing them there. So it is important to for you guys to know that that's not where the list is housed. Lots of questions in the queue about that.
Yeah, there'll be more and more of the PCPs loaded as the contracting is finishing up. So they're in the process of trying to, get more providers contracted. And they won't show up until they're contracted.
Yeah, we're really encouraging people to slow down, wait a little while, allow those lists to populate. If you want to know if your doctor is going to be contracting with the tailored plan, call your doctor's office and ask them. probably the best thing you could do right now and the easiest thing you could do right now, because you go searching through all those lists and they just may not be populated yet. So take your time. The choice period doesn't end until October 14th. You have plenty of time. It's only the 14th of September, so we have another month. Take your time, call your doctor, ask if they're going to be contracting with your tailored plan,
And
and watch for them in the list.
I don't want people to worry. Even if October 14th comes, they'll still have opportunities to, change the PCP or ask the tailored plan to give them a different PCP.
And keep in mind, PCP is your personal care physician. So
Yeah.
everyone that's asking about, I can't find my doctor, they're not in there. If they're currently doing Medicaid services today, there is a really strong likelihood they will continue to do Medicaid services. The only thing changing is the mechanism that they get paid and how Medicaid handles all that. So that if they're not in there now, certainly get in touch with them. And I'm sure the state's reaching out to connect with those folks because they already know who they are. But that's been a big concern. I've heard that in a number of calls. I can't get a hold of my doctor. Nobody's in the list. That's going to take some time for all those things to get populated. So if it's not there today and it's not there in a week, don't panic. If it's, we're there, I think those things are still going to be filling in as time goes by, including the care management agencies and all the different facilitators that are going to be involved in this. So that's just taking some time.
I recall seeing a question that caused me to think too. So if a PCP chooses not to enroll in tailored plan, yet their practice still takes Medicaid, would that family then be able to still use that particular doctor for physical health stuff? That question came up.
So if that depends on where the person is in those different Medicaid populations. So if the person was in Medicaid Direct, then they would be able to continue to use that physician or practitioner, physician assistant. If they were in the tailored plan, and Sandra, correct me if I'm wrong, then they would be getting their primary care work or physician, nurse practitioner, whoever, from a provider who's in the tailored plan network, correct?
That's correct.
Yeah.
Okay.
But as I stated a little while ago, every effort is being made to ensure that the networks are as robust as they can be.
Right. Yeah, there's a lot of work going on right now for those networks. And I think it's important to realize too, when Lisa talked about when standard plans went live, that was July, not last July, but the July before, and ramping up to those standard plans too, that contracting, it comes in kind of late, right? Because those agencies, those doctors, those nurse practitioners, those systems want to make sure that they have a good contract too. So I know that there's a lot of work going on, not just with the tailored plans to get them contracted with the state, but on that side as well, the primary care side, to make sure that they have a good arrangement that's sustainable.
It'd be also correct to say that just because a physician may not be contracted with a tailored plan on December 1st, they could still contract with them later, right? They could come into the network because on the medical side, it's a totally open network, all willing providers.
Right, for the physical health side, even the PTs or the physical therapists, the occupational therapists, all of that, everything that's kind of outside of the IDD, behavioral health, substance use, traumatic brain injury side, those are open networks. So they're really looking to fill those networks. And I think what I'm going to do is stop sharing my screen, and we can take some questions. And then we also have that list of questions, so we may hit some of those as we go through as well. Does that sound like a good plan?
Sure.
That'll give us a chance to look at the Q&A as well.
Mm-hmm.
All right. Would you all like me to just go through and ask some of these questions out loud? Would that help you, or?
Let's do that.
Let's do that.
Let's do that.
And again,
Okay.
just a reminder, because there are 84 questions and the list is growing, and I'm pretty sure there's a lot more than that floating out there. We're going to take what we can't get to tonight and do what we've been doing, which is pull them out, see if we can't get a collective answer. There's a number of these questions that fall into the same categories. We will turn around and continue to put out our FAQ so that you've got some information that you can work with. And we're going to be doing another 101 introduction to care management in a couple of weeks so that everybody gets exposed to and gets a chance to ask the really hard questions they've got.
So this one I just pulled, and I'm not going in order, but this person says, I'm not clear on why someone who has Medicare needs to have the tailored plan manage their physical health when Medicaid probably doesn't pay for it because that's covered under Medicare.
Right. So again, that only occurs for members who are on the NC Innovations waiver and for individuals on the NC TBI waiver. So oftentimes what happens is Medicare is the payer that happens first, and then Medicaid picks up some of that bill. We also realize that people who are using the Innovations waiver, the TBI waiver, those are long-term support services that really provide services to people to sustain them in the community. And we need to make sure that that service is maintained and have a mechanism for that to be provided.
Okay.
Yeah.
All right. Okay. So I'm just going to go through. Go ahead, Lisa.
Just add to that, the entire goal for this Medicaid transformation is to improve health and quality of life. So if someone has Medicare that's paying for physical health services and Medicaid's paying for innovations waiver services, the idea is you would have a care manager who helps coordinate all of that together, even though some of it's funded by Medicare, so that everything is working together in an integrated way to address everything that person needs in a coordinated way. Theory being, if we're coordinating, we're doing a better job, people have better quality of life, better health, less emergencies, less physical health cost. If we're being proactive and helping people improve health, our physical health costs will go down. That goes for any of us, right? So that is the reason why in this system change, your son or daughter having both would have someone helping, because that coordination is the heart of what we're moving into.
Right. I think that's a really good point. I think the other thing is that cost is one component, but if we think about better coordination of physical health and behavioral health and intellectual developmental support needs, that should lead to better health outcomes for the person too, because we know that there's so many intersections with those, people who have behavioral health needs. A lot of times the medications that they take leads to poor physical health outcomes. Being able to have everything integrated together should create better outcomes for those individuals.
Okay.
Yeah.
Yep.
Let me add, I'm sorry, I wanted to add, so even today or before any managed care launch, it was not uncommon for someone to have both Medicaid and Medicare. And, the providers do understand how that works, but you're going to have somebody who is managing your care now. So that's where I think the biggest reward is for the tailored plan and being a part of it.
So we have a couple of people who say they're just not clear on the difference between tailored plan and Medicaid Direct.
Sure. So I'll start, and then Sandra can fill in where I leave things out. So the tailored plan and the standard plan both offer whole person care that manages the physical health needs of the person, the pharmacy needs of the person, as well as the behavioral health, intellectual developmental disability support needs of the person. So it's paying for and managing all those kind of domains of the person's life. Medicaid Direct is different because in Medicaid Direct, the physical health supports that the person has and the pharmacy supports that the person has is not going to be managed by the same entity that's managing the intellectual developmental disability services and the behavioral health support services. So there's kind of a physical health side of the house that's going to pay for all of that services that the person needs. And then there's going to be behavioral health, intellectual developmental disability side of the house that's going to oversee and pay for those services. So if we think about the tailored plan, we think about all those services that I talked about, the physical health, the pharmacy, the IDD services, all in one circle, right? In Medicaid Direct, there's two different circles, one for pharmacy and physical health, and the other for those intellectual developmental disability services and behavioral health services. So the tailored plan is more of an inclusive whole person product.
And
Okay.
in managed and in in Medicaid Direct fee for service world, you have to remember there's not a whole lot of coordination between a lot of physicians. You can be going here and there, different places, and no one talking to each other or knowing what your whole health is. So this is the whole care coordination is big.
Yep, the tailored plan care management.
Yeah.
Okay. There are folks that are asking about applying for Medicaid. Is this the right time to apply for Medicaid? And folks that are on the waiting list for innovations, what should families like that be doing during this time?
So I think that if someone doesn't have Medicaid right now, and you believe that they may meet eligibility for Medicaid, it makes sense to probably apply for Medicaid. And you would do that. I think we have that online portal, right, Sanja? And then working with the local, the Department of Social Services in the county that you live in.
You can apply over the phone with the Department of Social Services. You can mail in an application, a paper application. You can also go through ePass, which is our portal to apply for any benefits. And you can also apply at the federal marketplace. And they do a screening for Medicaid, and then they'll pass it to our state right to our counties to know that you have applied. I was going to say, any day that you think that you're eligible for Medicaid, if you have that thought, you need to go ahead and apply. There's not a wrong answer to when to apply.
Okay, thank you. What is going to happen to folks who are dually eligible and they're on the waiting list, the Registry of Unmet Needs? What happens to families in that situation?
So if they're Medicaid and Medicare duals and they're on the waiver wait list, then they'll be in that Medicaid Direct system and they'll get their behavioral health IDD services through the LME MCO function.
Okay. So this person says, for those who are dual complete, I'm not familiar with that term. Do they still keep the insurance company that they've chosen for everything except the innovations waiver?
I think we might have to take that one back. I'm not familiar with that term either.
Okay.
I'm not familiar with that term either.
Okay. Let's see. Is there, okay, so then I've got some HIP questions. Is there an age limit for receiving NC HIP?
Don't think so.
Okay.
I'll have to look that up.
If a person is dually eligible and is an innovations waiver recipient and or an NC HIP recipient, I know they're on the tailored plan, but will receive tailored plan care management or care coordination. That was a statement, but I think it was is also a question.
I understand the question. So
Okay.
everybody who's on the innovations waiver or the TBI waiver has the choice of will have the choice of either tailored plan care management or care coordination. So if someone had the innovations waiver and NC-HIP, they could either have tailored plan care management through the plan or in the community, or they could have care coordination through the plan, which would be the tailored plan. I think that that's kind of a backstop for people who feel like they don't want to have that intensive tailored plan care management. But I don't suspect a tremendous amount of people will choose that. And that care coordination will basically look like the type of care coordination the person's getting through the innovations waiver now.
Okay. Can you provide guidance both for Medicare and Medicaid recipients, but also for those that receive private insurance and Medicaid/Medicare? Is that?
So that's the same. So if you have Medicaid, Medicare, and your non-innovations, your non-TBI waiver, then you're going to be in that Medicaid direct LME MCO combination, right? If you have Medicaid and Medicare and you're on the innovations waiver, the TBI waiver, you'll be in the tailored plan. And that private insurance that you have will still interact similarly to how it does now. So Medicaid is the payer of last resort, and I think all with that 3 options: Medicaid, Medicare, and private.
Okay. So this is kind of a, a general question, but who do families talk to if they haven't gotten their letter yet? They've not received any information in the mail about Medicaid Direct or this process. What do you suggest families do right now?
I would think that probably the best thing would be to contact the enrollment broker, and they can figure out what's kind of going on and move from there. The tailored plan should also have some information as well. It would be interesting to know if that individual for that question, that would be for the person to think about themselves if they have Medicaid, because if you don't have Medicaid, you may not be getting these types of notices.
Okay.
And also, if you can capture in the chat who that is, we can reach out and try to help figure that out as well.
Okay. Okay. We have United Healthcare Dual Complete and Alliance Standard Plan. Will the tailored plan take over medical insurance and mental health insurance, or do we need to drop United Healthcare Dual Complete? That's the second time I've heard Dual Complete.
I think we're going to have to take that one back. That's kind of that intersection between the type of Medicare product that the person has.
Okay.
So we'll definitely capture that in the chat.
Okay. My adult son is 30 on SSDI and has Medicare as his primary. Medicaid is second and has innovations. I was told today he could stay with his current doctor and not be on the tailored plan. Is that true?
So if he has the innovations waiver and he is not on, and he's not in the Eastern Band of Cherokee Indians or that tribal option plan, then he would be in the tailored plan. So I'm not sure who gave you that answer, but the one we're giving you, I believe, is correct.
Okay.
Mm-hmm.
All right. Do tailored plans include or exclude dental and vision benefits like the old plan?
Right. I believe that dental is not included. Sandra, do you know about vision? I'm not sure.
Vision, the only thing that is carved out is the fabrication of eyeglasses. So other than that, they should be covering. And then some of the plans now, folks need to look at their plans, their website, because a lot of the plans are offering dental services, even though that is carved out, they can choose. But some of the plans do offer some dental services.
Okay. I've seen a couple of families, and we've heard from them that say, in terms of medical care that somebody's receiving now, is everything going to continue as is assuming that their provider moves into the plan? Or are we going to run into logistical issues? And I'm worried about continuation of medical care, especially with my specialist visits, et cetera. We have a lot of worried families who have established specialists and appointments and are worried about a gap.
Sure. So what we have in the contracts with the tailored plans, as well as the standard plans, is a concept called transition of care. So if there is an authorization for a certain service and the person switches over from Medicaid Direct to the tailored plan or vice versa, or switches from a standard plan to a tailored plan or vice versa, that those authorizations are kept in that they're not disrupted. There's not need for additional prior authorization. Also, quite a bit of our physical health supports are set to, they don't have to be requested like some of our behavioral health services are. Some of them do, right? But really during this transition plan, the department is committed to try to keep everything as seamless as possible and not have people negatively impacted or have a loss of service.
Okay. Can you talk about folks who are on CAP DA and how this affects them?
Sure. So CAP DA is not going to be in the standard plan or the tailored plan. So for CAP DA, they would remain in Medicaid Direct. So they'd be getting their physical health services the way they are currently now. They would be getting their CAP DA services the way they currently are now. And then if they had a behavioral health support need or an intellectual developmental disability support need or a substance use need, they would work with the LME-MCO, which would be the tailored plan in that region. Similarly, there are people on CAP DA now who might receive a mental health service through the LME-MCO, or they may receive like respite or something like that from the LME-MCO as well. So it's going to be very, very similar for them. They'll also maintain their care management through CAP DA, and that's the same for CAP C. So tailored plan care management won't be for CAP C and CAP DA.
So to clarify, Kenneth, folks that are CAP C or CAP DA, do they need to do nothing, or what do they need to do? What is their action right now?
I believe they don't do anything, right? In order to, if they want to maintain that CAP C and CAP DA.
Okay.
And they would not have received a letter from the enrollment broker.
Right, they should not have.
Right.
Okay. One of our staff members said something that I think is very fair. I called a primary care office today, a big one, to ask if they're contracted with the tailored plan, and they had zero idea what I was talking about.
Right.
So I know that's not a question. I know that's not a question, but that's going to be a concern for lots and lots of families out there. Yeah.
And who did you say they called?
Well, this just said Duke primary care. Just and the person whoever this person talked to had no clue.
Yeah.
What was being asked.
Right, and I think we have to think though too, when you, if you're calling like a major kind of system like Duke Health or UNC Pediatrics or something like that, the person who answers the phone is probably not involved with any of the contracting with Medicaid, with the standard plan, or with the tailored plan, right? Their job is more focused on appointments and triaging. So I think that could occur. You know what I mean?
Sure. What is the title? Who should they direct their calls to when families are calling? Because they don't know.
Saying an office manager. There's usually an office manager in a physician's group or a physician's office that handles those kinds of things.
Okay. All right. Still getting lots of questions about where the lists are located. So we'll repeat it again, that you need to not go to DHHS website. You need to go to your LME-MCO and they will have the lists. How do we contact the enrollment broker or contact the tailored plan phone numbers? We will get the enrollment broker in the chat, and your tailored plan is your current LME-MCO. So
and that number is listed on the letter that you received.
Okay.
Yeah.
Last week, my brother's PCP was listed as a TC provider, but this week it has disappeared. So the website is a bit confusing for families.
Okay, we'll take that back as well.
Okay. Can I have some clarification on B3 waiver participants? This is the first time that I've heard that they would stay Medicaid direct, and that is confusing. Previously, we were told more services would be available through the I waiver, but it doesn't seem those services will be accessible if they're offered through the tailored plan, but B3 recipients are Medicaid direct.
So again, I'm just going to do some clarification. So if you have B3 services and you have Medicaid and Medicare, you'll be in Medicaid direct with the LME MCO. If you're receiving B3 services and you just have Medicaid, then you will be in the tailored plan. So I think that's an important distinction. It goes back to that third slide with those boxes. What else I can say is that the 1915I services are going to be available through the tailored plan, as well as the LME MCO function of the tailored plan. So the reason that we built the 1915I services in the tailored plan and in the LME MCO function is to basically for the reason that was just described, is to make sure that people who have Medicaid and Medicare are able to receive those services. And that's important because a lot of times if someone has, in our current system, if they have Medicaid and Medicare, they may be carved out of the LME MCO system. So they're using more, they're carved out of the Medicaid side of the LME MCO system. So then they end up using more state funded services, which is a more of a limited pot of money. So this should make things more sustainable, and the I option will be available for both of them. And I know that John and Lisa said that you all will be doing some more outreach around the I, so that will be good for you all to hear on a different day.
Yeah, and let me just add to that, Kenneth, we may have you back to talk about the I option, but currently the system is made up of the C waiver, which is in IDD world, we know that is the innovations waiver, and the B waiver, which helps format the LME MCO system. That B waiver is going away, and the I waiver is another Medicaid waiver. These are all pots of money within Medicaid that we can access. The I waiver will be birthed, will be starting up on or around December 1st. And for a lot of people receiving B3 services, we'll be able to just map those services right over to the I waiver services. Not for everybody, and we don't have guarantees about that yet. It's still in development. But our hope is that for many people who need those B3 services, they'll be able to transition those over to the I waiver services once they're up and running. We're on the verge of getting more detail about that from Kenneth and other people at DHHS. And we're talking about doing a whole separate webinar around that I waiver services because it's another confusing piece of this that people have a lot of questions about. It's the kind of services people might be receiving now that are funded through this B3 pot of Medicaid dollars, respite, supported employment. There's some community living type of supports in those as well. And so you'll see those funded in a different way, but a lot of it will look the same.
Correct. Right.
Thanks for
And
that.
so then in the I, just to say, so right now we have an in-home skill building that's really intensive in the B3 benefit. With the I, there's going to be a more long-term community living support that's going to look more similar to the innovations waiver service. That's probably the most used service in the innovations service. And it's a blend of kind of personal care support as well as skill building.
So real quick, and this is a little bit of an aside from the normal line of questioning we've been doing, but it came up the other night in the webinar that you were on, Kenneth, and it came up again this evening. Somewhere on the website that is the link to everything that, sign up. There is it refers to an ICFMR, but it uses the words printed out. I'm sure the state is not aware that where that is. We need to track that down and make sure that that gets.
So, right, so I think that was raised Monday, so we have a request in to have that changed on the website.
Cool. Thank you.
I'm sorry, Kenneth, go ahead, go right ahead.
Oh, no, I'm just saying, I think I'm not sure how long we had scheduled today. I don't think we'll get to all these questions and
Right.
answers. I think a lot of the questions that we got previously had to do with, where everybody fell. We kind of answered those through the presentation and through here now. But it'll probably be good for us to get a copy of some of these questions and answers so we can work with
Absolutely.
you on some kind of FAQ.
Absolutely. I'm going to ask one more question before we roll out, but well, let me ask that. So can you talk about out-of-network services? There are some families asking questions in here that can they just go to a doctor out of network, or can you just talk about out-of-network benefits under the tailored plan?
I don't think I can. I'm not
Okay.
sure, Sanja, I'm not too much
Yeah,
involved in that contract language.
Okay. All right.
There.
Okay, we can get that answered. So there is a request if we could send out a PDF to folks with your slides, if that is a possibility.
Sure.
Okay, so we are recording, of course, you guys, and we will post this recording on our YouTube channel, which you can find by going to our webpage or just searching for the Arc of NC. We have a Medicaid transformation playlist. All of these videos, webinars are in there. In a few days from now, this webinar will also be translated into Spanish. So we'll have a Spanish version of this webinar up for you, and we will make sure that we give you all access to a PDF of the slides today. So we have still 123 open questions in the Q&A. So of course we're not going to be able to get to them, but I have them all, which I'm so grateful that you all put them in here, plus submitted them ahead of time. We're gathering them, we're categorizing them. We will get your questions answered, and apologize if we didn't get to your question today, but thank you. Yes, sorry,
Let me offer my invitation to everyone on this call. We have a link. It's been available to you. If you have questions, the ones we haven't answered, we will answer. We'll find what we can find. If you have more questions, please keep sending them in to us. And while on our end, that's a little daunting because those numbers are going to go up. But if we don't know the questions and concerns you have, there's no way we can help find the answers that we're looking for. And so keep sending those in to us. We're going to bundle the questions into groups. If there are multiple questions along similar lines, we'll try and answer one and not all of them. But again, hopefully we'll be able to get to everything by the time we get through all of this. We'll be a lot wiser and a lot more experienced. So keep at it and keep sending your questions in, please.
It helps all of us. So thank you both for joining us, and Lisa and John, of course. Very, very helpful. We're not done. We'll see you guys for the next one on September 19th. And by then we'll have a date for the October webinar, and we are all in this together, learning together and sharing the information as we get it. So
Linda,
thank you for
Linda, the link to the Q&A or to the question submission, where is that at?
it is, that's a great question. It is not on the website, but we're putting it on the website this afternoon. So
okay, so it'll be on the website where you can get at it.
Yeah, we've been posting it on social media and in communications, but we can get that on the website. So
thank you.
Thanks everybody for joining us, and we will see some of you on September 19th. And thanks for coming today. Bye.
Thank you for having us.
Thanks for having us.
Thanks, Kenneth. Thanks, Sanja. And thank you, everyone that's here.